Nurse Aide Test Prep GTCC. Question 1. When communicating with a client with dementia, the nurse aide should: Option A. Use complex medical terms. Option B. Use simple, one-step directions. Option C. Speak loudly. Option D. Ask open-ended questions. The correct answer is option B. Use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 2. The nurse aide's role in rehabilitation includes: Option A. Performing all ADLS for the client to save time. Option B. Encouraging the client to perform ADLS independently. Option C. Telling the client they cannot do anything. Option D. Leaving the client alone to figure it out. The correct answer is option B. Encouraging the client to perform ADLS independently. The nurse aide's role in rehabilitation is to encourage and assist clients in performing ADLS independently to restore or maintain function. Doing everything hinders progress. Question 3. Standard precautions apply to which bodily fluids? Option A. Blood and blood products only. Option B. All body fluids, secretions, and excretions. Option C. Only visible blood. Option D. Only if the client is diagnosed with an infection. The correct answer is option B. All body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious. Question 4. When assisting a client from lying to sitting position, the nurse aide should: Option A. Have the client sit up quickly. Option B. Sit the client up slowly and allow time for blood pressure to adjust. Option C. Pull the client's arms to sit them up. Option D. Have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 5. The proper body mechanics for lifting includes: Option A. Lifting with the back. Option B. Lifting with the legs. Option C. Twisting while lifting. Option D. Lifting with arms extended. The correct answer is option B. Lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 6. A client is pacing and appears anxious. The nurse aide should: Option A. Ask the client to sit down. Option B. Walk with the client. Option C. Give the client a sedative. Option D. Leave the client alone. The correct answer is option B. Walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 7. A client who is withdrawn and refuses to speak to anyone is likely experiencing: Option A. Depression. Option B. Anger. Option C. Excitement. Option D. Anxiety. The correct answer is option A. Depression. Withdrawal and refusal to communicate are common signs of depression in the elderly and chronically ill. While anxiety and anger may include withdrawal with silence more strongly suggests depression. Question 8. A client becomes upset and tearful while discussing their recent diagnosis. The nurse aide should: Option A. Change the subject to something more positive. Option B. Tell the client to stop crying. Option C. Sit with the client and allow them to express their feelings. Option D. Leave the room to give the client privacy. The correct answer is option C. Sit with the client and allow them to express their feelings. Allowing the client to express emotions and providing a supportive presence validates their feelings and helps them process difficult information. Changing the subject dismisses their feelings. Telling them to stop crying is insensitive. Question 9. A client with Alzheimer's disease gets upset because they cannot find their deceased spouse. The nurse aide should: Option A, remind the client that their spouse is dead. Option B, gently redirect the conversation to a pleasant memory of the spouse. Option C, tell the client to stop worrying. Option D, call the nurse to explain the situation. The correct answer is option B. Gently redirect the conversation to a pleasant memory of the spouse. Redirecting to a pleasant memory validates the client's feelings while avoiding the distressing reality. Reminding them the spouse is dead may cause repeated grief. Dismissing their worry doesn't address the emotion. Question 10. The nurse aide should report which change in a client's vital signs? Option A, pulse increasing from 72 to 76. Option B, blood pressure increasing from 118/76 to 126/82. Option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. Option D, respirations decreasing from 16 to 14. The correct answer is option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. A temperature increase to 101.4 degrees Fahrenheit indicates fever and requires reporting. Minor variations in pulse, 72 to 76, blood pressure, 118/76 to 126/82, and respirations, 16 to 14, are within normal ranges and may not require immediate reporting unless accompanied by symptoms. Question 11. The nurse aide's primary scope of practice includes: Option A, performing sterile procedures. Option B, inserting urinary catheters. Option C, assisting with activities of daily living. Option D, administering medications. The correct answer is option C, assisting with activities of daily living. The nurse aide's primary role is assisting with ADLS such as bathing, dressing, toileting, feeding, and mobility. Sterile procedures, catheter insertion, and medication administration require licensed nursing staff. Question 12. The apical pulse is located at the: Option A, wrist. Option B, neck. Option C, apex of the heart, fifth intercostal space, midclavicular line. Option D, elbow. The correct answer is option C, apex of the heart, fifth intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the fifth intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 13. A client with a pulse of 112 beats per minute is experiencing: Option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 14. A client with dementia frequently repeats the same question. The nurse aide should: Option A, explain that they already answered the question. Option B, answer the question patiently each time. Option C, ignore the question. Option D, write the answer on a whiteboard. The correct answer is option B, answer the question patiently each time. Repetitive questioning in dementia clients is due to short-term memory loss. Answering patiently each time shows respect and reduces anxiety. Explaining that the question was already answered frustrates the client who cannot remember. Question 15. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B, weigh the client at the same time each day. Weighing at the same time each day, example, before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 16. A client with dementia becomes aggressive. The nurse aide should: Option A, restrain the client immediately. Option B, remove themselves from the situation and seek help. Option C, yell at the client to stop. Option D, ignore the behavior. The correct answer is option B. Remove themselves from the situation and seek help. Aggressive behavior in dementia may indicate unmet needs or pain. The aide should ensure safety, step back, and seek help. Restraint requires an order. Yelling escalates behavior. Ignoring is unsafe. Question 17. What is the correct way to transfer a client from bed to chair? Option A, pull the client by their arms. Option B, use a transfer belt and proper body mechanics. Option C, lift the client under the armpits. Option D, have the client stand without assistance. The correct answer is option B. Use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 18. When giving a bed bath, water temperature should be approximately: Option A, 90 to 95 degrees Fahrenheit. Option B, 100 to 105 degrees Fahrenheit. Option C, 110 to 115 degrees Fahrenheit. Option D, 120 to 125 degrees Fahrenheit. The correct answer is option B, 100 to 105 degrees Fahrenheit. Water for a bed bath should be 100 to 105 degrees Fahrenheit, about 37.8 to 40.6 degrees Celsius. This temperature is comfortable and does not burn. 110 to 115 degrees Fahrenheit can scald sensitive or elderly skin. 120 to 125 degrees Fahrenheit can cause burns. Question 19. When removing PPE, which item should be removed first? Option A, gloves. Option B, gown. Option C, mask. Option D, goggles. The correct answer is option A, gloves. Gloves are the most contaminated item and should be removed first to avoid contaminating other items. The correct sequence is gloves, goggles/face shield, gown, mask. Question 20. A dying client is breathing irregularly. The nurse aide should: Option A, call the nurse immediately. Option B, continue to provide comfort care. Option C, administer oxygen. Option D, start CPR. The correct answer is option B, continue to provide comfort care. Irregular breathing, Shane Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status. Do not resuscitate. Question 21. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D, remove the food after 15 minutes. The correct answer is option B, provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 22. The nurse aide should speak to a client who is hearing impaired by: Option A, speaking very loudly. Option B, speaking slowly and clearly while facing the client. Option C, writing everything down. Option D, asking a family member to translate. The correct answer is option B, speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 23. A client with dementia is pacing and appears anxious. The nurse aide should: Option A, restrain the client to prevent falls. Option B, encourage the client to sit down and rest. Option C. Walk with the client in a safe area. Option D. Leave the client alone. The correct answer is option C. Walk with the client in a safe area. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Pacing is a common behavior in dementia. Restraining increases agitation. Forcing the client to sit may escalate behavior. Question 24. When receiving a report at shift change, the nurse aide should: Option A. Ask questions about unclear information. Option B. Write down everything quickly and leave. Option C. Ignore information about client preferences. Option D. Rely on the previous aide's verbal report only. The correct answer is option A. Ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 25. Systolic blood pressure represents: Option A. The pressure when the heart is at rest. Option B. The pressure in arteries when the heart contracts. Option C. The pressure in the veins. Option D. The pressure in the capillaries. The correct answer is option B. The pressure in arteries when the heart contracts. Systolic pressure is the maximum pressure during left ventricular contraction, systole. Diastolic pressure, option A, is when the heart rests. Venous and capillary pressures are not part of standard blood pressure measurement. The systolic is the first sound heard.